1. May improve nerve damage caused by alcohol consumption or diabetes. According to an 8-week randomized controlled study on 84 patients published way back in 1998, benfotiamine, either alone or in combination with vitamins B6 and B12, demonstrated significant effectiveness in improving alcoholic polyneuropathy symptoms. Notable improvements were observed in vibration perception, motor function, and the overall score reflecting the entire spectrum of alcoholic polyneuropathy symptoms. No therapy-specific adverse effects were reported during the study. And according to a 6-week open clinical trial on 36 diabetic patients suffering from painful peripheral diabetic neuropathy, published the next year, benfotiamine is effective in relieving painful diabetic neuropathy. The high dose of benfotiamine vitamin B showed the most improvement, but even smaller doses, either alone or in combination, were effective. In another clinical trial on 14 males with stage 2 to 3 chronic alcoholism, published in 2001, using benfogamma for 6 weeks showed positive results. Pain, sensory, and movement issues improved, and some neuropathy symptoms got better. Benfogamma is a medication that contains benfotiamine as its active ingredient. Also, in a 3-week randomized controlled pilot study on 40 participants with a history of type 1 or 2 diabetes and polyneuropathy of not longer than 2 years, published in 2005, 50 milligrams of benfotiamine 4 times a day significantly improved neuropathy score compared to the placebo group. The most noticeable effect was a reduction in pain. Moreover, in a 2008 randomized controlled trial on 165 patients with symmetrical distal diabetic polyneuropathy, 6 weeks of benfotiamine treatment showed significant improvement in specific neuropathy symptoms, especially at higher doses. The overall impact on a range of symptoms was not as pronounced though, but pain showed the most improvement. Furthermore, according to a clinical trial on 22 diabetic polyneuropathy patients published in 2009, the combination of benfotiamine and vitamin B6 significantly reduced pain, improved various symptoms, and positively impacted neurophysiological parameters. The treatment also led to a significant reduction in glycosylated hemoglobin levels. The majority of patients reported an overall improvement in their condition, indicating that benfotiamine could be a beneficial starting choice for treating diabetic polyneuropathy. 2. May be used as an additional therapy during alcohol rehabilitation. In a double-blind, randomized, placebo-controlled clinical trial on 20 non-treatment-seeking individuals with alcohol dependence published in 2013, 600 milligrams of benfotiamine once daily for 24 weeks significantly reduced alcohol consumption in women participants. In another randomized controlled trial on 85 adult men with alcohol use disorder, published in 2015, taking benfotiamine 600 milligrams daily for 6 months reduced psychological distress, particularly in those with more severe alcoholism. This suggests that benfotiamine could be a helpful addition to the treatment of alcohol-related psychiatric symptoms.
By the way, before I continue, if you're new here, I'm Jera from the Philippines.
Welcome to my channel where I share my knowledge and discoveries about everything related to natural health remedies and personal development gained from reading scientific journals and books written by doctors and experts. If you also have a gluttonous appetite for new knowledge, please consider subscribing. Also, you may want to check out my ebook, 40 Wrinkle Fighters Other Than Retinol, backed by scientific studies. Just click the link in the description box below for more details.
Moving on. 3. May be helpful for mild Alzheimer's disease. A 2016 publication in the Neuroscience Bulletin concluded that benfotiamine significantly improved the cognitive abilities of mild to moderate Alzheimer's disease patients independently of brain amyloid accumulation. The small sample size and absence of a placebo group highlight the need for expanded research, though. In a year-long study involving 70 participants with amnestic mild cognitive impairment or mild Alzheimer's disease published in the Journal of Alzheimer's Disease in November 2020, oral benfotiamine demonstrated safety and potential efficacy. Participants received either benfotiamine 34 or a placebo 36. Benfotiamine showed a 43% reduction in cognitive decline, not statistically significant, and a significant 77% decrease in clinical dementia rating worsening. It also lowered advanced glycation end products increases. However, limitations include a relatively small sample size and certain outcomes not reaching statistical significance. 4. Might help decrease pain and inflammation in people with osteoarthritis. According to a randomized controlled trial on 30 osteoarthritis patients published in August 2013, a combination of 50 milligrams of benfotiamine, 50 milligrams of pyridoxamine, and 500 micrograms of methylcobalamin are effective on decreasing pain and inflammation and increasing daily activity and mobility in osteoarthritis patients. However, further research is needed to know which specific B vitamin had the most impact. 5. May counteract the detrimental vascular effects of smoking in healthy people. In a 2012 study examining the impact of smoking on vascular function, 20 healthy volunteers, mean age 38 years, underwent assessments of flow-mediated vasodilatation, FMD, and soluble vascular cell adhesion molecule 1, SVCAM1, in a randomized, crossover, and investigator-blinded design. Following cigarette smoking, a significant reduction in FMD by 50% was observed, mitigated to 25% with short-term benfotiamine treatment, 1,050 milligrams per day for 3 days. Benfotiamine also prevented the smoking-induced elevation in SVCAM1. The endothelium-independent vasodilation remained unchanged. These findings suggest that benfotiamine exerts protective vascular effects against smoking-induced endothelial dysfunction in healthy volunteers. However, considering the modest sample size, further research is warranted to validate and extend these observations. 6. May help reduce DNA damage in hemodialysis patients. In a randomized controlled trial published in September 2008, researchers looked into how hemodialysis patients, who often have high genomic damage, could benefit from benfotiamine. In 2 studies, they gave these patients benfotiamine and checked for changes in genomic damage, plasma AGE levels, and antioxidative capacity. Benfotiamine significantly lowered genomic damage in both studies, no matter the changes in AGE levels. The second study hinted that benfotiamine boosted antioxidative capacity, potentially helping protect DNA. Keep in mind, it's not a massive study, and more exploration is needed. Since benfotiamine is fat-soluble, it's best to take it with food. The safety profile of benfotiamine is not well established due to a lack of comprehensive clinical studies. While there haven't been any reported adverse effects from benfotiamine alone in scientific literature, anecdotal evidence suggests some cases of nausea, dizziness, and low blood pressure.
Before taking any supplements, it is important to consult with a healthcare professional or your doctor. If you have a known kidney or liver condition, your healthcare provider may suggest regular monitoring of kidney and liver function through blood tests.
When it comes to supplements, it's important to be extra careful, especially now with the rise of reports about fake products floating around on platforms like Amazon. Big supplement players like Now Foods and Fungi Perfecti have actually come across instances where their products were counterfeited and sold. Fungi Perfecti found a bunch of Amazon sellers pushing knockoff versions of their Host Defense mushroom supplements. And Now Foods stumbled upon fake versions of their stuff. Psyllium husk capsules, magnesium citrate, and a men's multivitamin, all being peddled by just one Amazon seller. To stay on the safe side, shop directly from the brand's website or trusted sources like iHerb, and don't forget to make sure there's been third-party testing for that added peace of mind. You can save some money by using the code APT0317 when you check out. Copy and save this special discount code because it doesn't have an expiration date. You can use it whenever you shop on iHerb.com.
Just remember, what works for some people may not necessarily work for everyone. If you already tried it all and followed many doctors and health gurus, but nothing worked, you may find the answer by doing some digging into your genes. If you want to get to the root cause of some of your health issues, the first step is to find your problem genes. Taking personalized supplements based on your DNA may also help, and Self-Decode can help you with that. Self-Decode provides personalized health recommendations based on a combination of your DNA, labs, and environmental factors. There are just too many diets, supplements, and health hacks out there to waste your time and money on stuff that probably isn't going to work for you. So if you want to experiment in the most efficient and effective way, click on the link in the description box below to check out Self-Decode and unlock your own genetic blueprint. If you've learned something you didn't know before watching this presentation and you appreciate the time I invested in researching, writing, and creating this presentation, please give this video a like. If you're interested in looking and feeling your best and exploring natural solutions, please consider subscribing. Thanks for watching!